We have high levels of deprivation in this area and some of the highest and most deprived wards across the country. And what we know is that there is a real strong link between deprivation and depression and anxiety and poor health outcomes generally. So we know we have a higher level of postnatal depression in mums and generational relationship issues with complex family situations that are often unhelpful for new mums with their small babies. Poor housing, we also know, has a massive effect on people's emotional health. So we have a real unique set of issues here. Teenage pregnancy is very high as well, so a lot of very young mums who need support, and we've got the Family Nurse Partnership that helps with that, and we work alongside other agencies. We're now about to start a pilot scheme where we work intensively with families that have been identified by Children's Services as really vulnerable and in need, to see if we can change some of the outcomes for those children. Thanks for coming in to see me today. I've asked what we know is that the relationship that you have with your parents in the first year of life sets your emotional health for the future. So it's really important that we get and help that families in that first year of life as an early intervention, prevention of future mental health problems.
There's been times when just struggling a bit, I think, really.
It is absolutely normal and fine that as everybody can come along to the Priory Centre and you can get a specialist mental health service, and families really value that ability to be able to come along and access those services here. I started as a paediatric nurse, did my training here in Norfolk and spent 3 years on the ward at the NNN. And as a student nurse, I'd had a really interesting placement with a health visitor in Norwich and decided that eventually that was where I wanted to be. So after 3 years on the ward, I did my training here in Great Yarmouth and then was lucky enough to be employed after that. And I've been a qualified health visitor for 8 years. I think quite quickly after I qualified, I noticed that where mums particularly were feeling vulnerable with low mood, that a lot of the health messages that I had to give across as a health visitor weren't particularly easily acceptable to a mum who was really low in her boots, you know, depressed and was finding life difficult. So I identified quite early on really that there needed to be another way to support mums so that to enable them to give the health message, take the health message on board that I had to give. And through that I developed my interest in working with mums with postnatal depression, and then to look at the whole relationship between mums and babies and dads and babies. And that led me to with sponsorship from the Priory Children's Centre and the PCT as was, that led me to a master's course in a specialist course for parent and infant mental health at the Tavistock in London. So I now have a postgraduate certificate in parent and infant mental health, and I'm currently working towards the dissertation, so I'll have a full master's in parent and infant mental health. I really feel that we are making a difference and that we're enabling people to have a better start in life, really. People who aren't given the same resources that we have as ourselves, and we're giving them some resources to take them forward into the future for better outcomes for themselves and for their children.